a chair and let me tell you a story. We'll call it a tale of two states. In one state, we have a Democratic governor who mandated that nursing homes take in sick patients who tested positive for COVID-19, resulting in the avoidable death of thousands of seniors. In another state, we have a Republican governor, one who didn't put nursing homes at risk and who is now opening up his state for business because their COVID numbers are so low. And guess which one the left is accusing of murder? Hint, it's not the one with all the bodies in his backyard. Back in March, New York Democratic Governor Andrew Cuomo ordered nursing homes to take in patients who'd been sent to the hospital and had tested positive for COVID-19. In doing so, he effectively turned the state's nursing homes into human petri dishes where the virus could spread among the most vulnerable. 3 COVID-19 patients were transferred to the Gerwin Jewish Nursing and Rehabilitation Center on Long Island. Within a month, 24 residents were dead. In late April, 70 COVID patients were sent to Harlem's Terrence Cardinal Cook home. By May 8, 32 people were dead. 19 were sent to Staten Island's Carmel Richardson home. By May 8, 56 people were dead. Hospitals in New York City have reported that anywhere between 10 and 35% of their released COVID-19 patients were sent to nursing homes and rehab centers. While the media were busy kissing Cuomo's butt, calling Trump a murderer, and mocking dim-witted anti-science Republicans for pointing out that economic devastation kills people too, Cuomo's little experiment was causing the virus to spread throughout nursing homes like wildfire, killing people by the thousands. The problem got so bad, in fact, that early this month, the New York Health Department began omitting the number of COVID deaths of nursing home residents who died in hospitals. So far, we know more than 5,300 nursing home residents have died of COVID-19 in New York, and we know that number has been vastly undercounted. But now, Cuomo is claiming that nobody should be prosecuted for those deaths. Why? Well, because he would be first in line. Except he's justifying himself by saying that old people were going to die anyway. Not kidding. Here he is this weekend.
Older people, vulnerable people, are going to die from this virus. That is going to happen, despite whatever you do. Because with all our progress as a society, we can't keep everyone alive, despite everything you do. And older people are more vulnerable. And that is a fact, and that is not going to change.
Which is weird, because when us non-liberals were over here pointing out that some deaths were probably inevitable and that a total national shutdown was not a good or feasible solution, we were accused of killing grandma for our stock portfolio. But at least we weren't cramming sick seniors together like cattle, then omitting their deaths from our reports. And at the same time, we have Florida, where Governor Ron DeSantis, a Republican, is ahead of the curve in reopening his state and trying to get back to normal. He's pointed out that Florida had never spiked the way that some health officials had feared, even though it was one of the last states to impose a lockdown. Florida nursing homes have seen fewer than 700 total deaths despite its very large elderly population, but then again, DeSantis also never ordered them to take back infected seniors, so maybe that helped. Instead, he directed millions of face masks and protective gear to nursing homes. He restricted visits and created emergency response teams to assess what supplies and resources they needed. All nursing home staff were required to wear PPE and get their temperature taken before work. In Florida, there have only been a total of 1,364 COVID-19 deaths in a state of 21.5 million people. But that hasn't taken DeSantis out of the media's crosshairs during this whole thing. When it started, MSNBC slammed him for his botched response to the virus, predicting doom and gloom and accusing him of killing people.
This week, Governor Ron DeSantis finally issued a stay-at-home order for the entire state of Florida, but it took weeks and plenty of criticism for him to come to this decision. Now the state is a hotspot for the spread of coronavirus, with more than 10,000 confirmed cases and more than 100 deaths. Those numbers are expected to continue climbing. The state's healthcare and social programs have been put under immense strain as well. Is the governor's botched response to this outbreak going to cost even more lives?
When Florida began reopening, attorney Dan Ulfelder, who once dressed as a Grim Reaper and stomped around Florida's beaches to make social distancing points, accused DeSantis of having blood all over his hands. The Daily Beast is predicting that the reopen will go horribly wrong, posting this along with a photo of a Trump supporter, of course. CNN begrudgingly admitted Florida's success, but claimed that it was mostly luck that got them there. 1/3 of all COVID-19 deaths in the U.S. have been in nursing homes. That is the single most vulnerable population. But instead of criticizing the Democrat who single-handedly put that population in the line of fire, the left wants to slam Republican governors in other states that are reopening their economies. Because those governors are smart enough to understand that according to the data, the vast majority of healthy people are not at risk and can go about their daily lives just fine. Because this is not about the virus, or keeping people healthy, or preventing death. We knew this virus disproportionately affected the elderly from the get-go, but Cuomo threw open nursing home doors and mandated that they import this disease anyway. If this shutdown had really been about preventing death, that never would have happened. The media would have been all over it. He'd have been labeled a murderer and run out of town. If this were about preventing death, the left would not be throwing a fit over governors who let healthy families take their kids to the beach. They'd be focusing on the ones who intentionally and knowingly put the most vulnerable at an even higher risk. And that right there tells you that this is not, and has never been, about preventing death. It is about politics. And that's your Reality Check, America. Make sure you subscribe to our YouTube page, that you like us on Facebook and Twitter. Stay sane out there.